Hey guys, Jeremiah here to review bag valve mask ventilation of an apneic adult patient. So to start, I want to bring up a couple points real quick. One, when you start the station, you're going to be given 2 minutes to look over your equipment. I highly encourage that you do that. When you're testing, I want you to be familiar with the equipment you're using. The regulator, for instance, this knob here makes it look like it would be good for adjustment. It's not. You actually use the other side. So you want to be familiar with the equipment that you're using. Take a look at the BVM. Make sure you know where the oxygen actually attaches to the bag itself. Look at your suction equipment, the tubing. See if your rigid catheter has a hole in it where you would initiate suction with your thumb, things like that. Secondly, I want you to be aware of the fact that you need to ventilate for at least 1 full minute each time. So initially you're going to ventilate your patients for 1 full minute unattached to oxygen. Then afterwards you're going to do your reassessment. And after you do your reassessment, you want to connect the O2 tank to the BVM and you need to ventilate again for 1 full minute. I see a lot of students coming up short, so make sure when you come to the station you're also wearing a watch. It's the best way to keep track of time. All right, so I've looked over my equipment. I believe I have everything I need, and I'm going to ask my proctor for the scenario.
Upon arrival to the scene, you find a patient lying motionless on the floor. Bystanders tell you that the patient suddenly became unresponsive. The scene is safe and no hemorrhage or other immediate problem is found. You have 5 minutes to complete this skill.
All right, so I'm going to begin. My BSI is on. I'm checking to make sure that my scene is safe. I'm going to come in and assess for responsiveness. When I walk in, is my patient alert?
No.
Next thing I'm going to do is say, "Sir, can you hear me?"
Patient's unresponsive.
I'm going to provide painful stimuli by doing or performing the trapezius squeeze.
Patient is unresponsive.
All right, so my patient is unresponsive. At this point, I'm going to activate EMS assistance. I'm going to call for EMS. I'm going to open my patient's airway with a head tilt chin lift maneuver. When I look in the mouth, what do I see?
The mouth is full of secretions and vomitus.
All right, so I note that the patient's mouth is full of secretions and vomit, so I'm going to prepare my rigid tip suction catheter. I'm going to make sure all my tubing is attached. I'm going to turn my catheter on. I can measure from the corner of the mouth to the tip of the ear, but more importantly, I'm going to make sure I insert no further than I can see. I'm going to suction on the way out in a circular motion.
Mouth and oropharynx are clear.
Mouth and oropharynx are clear. I'm now going to choose the appropriate size OPA, measuring from the corner of the mouth to the tip of the ear, inserting tip towards the roof of the mouth, and rotating 180 degrees.
No gag reflex is present. Patient accepts OPA.
I'm now going to ventilate my patient 1 breath every 5 to 6 seconds for a full minute. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, breathe. 2 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, breathe. 3 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. 4 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. 5 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. 6 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. 7 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. 8 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. 9 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. 10 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. At this point, I ventilate for a minute. I'm going to recheck for a pulse and breathing simultaneously.
Patient is still apneic, has a weak carotid pulse of 60.
At this point, I'm going to turn my O2 tank on. Connect my tubing. Set my flow meter to 15 liters, 100% oxygen. Make sure that all the tubing is connected. I'm going to reopen my patient's airway using the head tilt chin lift. I'm now going to ventilate my patient again, 1 breath every 5 to 6 seconds for a full minute. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. 2 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. 3 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. Okay, so I ventilate my patient for a full minute.
How would you know if you're delivering the appropriate volume with each ventilation?
I would look for equal and bilateral rise and fall of the chest. I'm done with the station.